AIDS, acquired immune deficiency syndrome, was an epidemic that swept the nation in the 80s. Many AIDS activism groups were started to fight for those with AIDS. One such group, the Names Project, started a collaboration in order to honor those who had been victims of the disease. This was called the AIDS Quilt. The stories told by the quilt, combined with the sheer number of panels, made AIDS a tangible crisis and not something that could be ignored. The quilt was able to break down the barrier of prejudice by showing the victims as people. People with faces, people with family, and, most importantly, people with names.
Bob Charpentier, Dennis Dane, Dale Anker.
What's now known as AIDS started out as a strange sickness that no doctor could place. Medical professionals began noticing the symptoms of an illness in otherwise healthy people. Symptoms like pneumonia, shingles, and Kaposi sarcoma, a type of skin lesion. In July of 1981, the first article about AIDS was published in the New York Times, bearing the headline, "Rare Cancer Seen in 41 Homosexuals." In 1982, the term AIDS was first used. AIDS, as shown with the headline, was primarily known as a gay disease.
It shows that the lifestyle of some male homosexuals has triggered an epidemic of a rare form of cancer.
This was because many gay men contracted AIDS due to unprotected sex, since condoms were seen as a method of birth control and not as STD prevention. The AIDS epidemic strengthened the homophobia that was already present in society.
I would say that the epidemic had the effect of worsening what stigma existed before the epidemic became very intense once there was a virus that was associated with queer people. It went from there being a mental illness stigma or a criminality stigma to a physical health stigma.
For gay men who were afflicted, it was seen as a righteous punishment for their sexuality.
Then I said, but God, if the only way he can know you is to have AIDS, I ask you in the name of Jesus to give him AIDS.
For those who did not fit into the typical mold of an AIDS patient, it was difficult as well.
My mother was sick for years. She had unusual types of illnesses and symptoms that nobody really put together as a major indicator. Nobody was putting these pieces together because she didn't fit into any of the stereotypes. So it took her years of having symptoms and various illnesses before anyone even considered testing her. And because my mother didn't fit into any of the other stereotypes, the doctor was even hesitant to even consider testing her for it. And in fact, that's what she had.
Even further, when the issue of AIDS was brought up in government, it was greeted with prejudice. Additionally, the AIDS crisis was taking a huge toll on the gay community due to the stigma and the amount of losses they had to endure. Over 58,000 people died of AIDS from 1981 to 1990, the same amount of American soldiers lost in the Vietnam War.
Well, I really wish people would start referring to it as the war, the AIDS war instead of the AIDS crisis, because for us it was a war. It was a battle that we fought, and our friends died. And the loss of that tragic loss, and then seeing other friends die and going to the funerals and with their panels on the quilt, we had to fight that war. And those of us that survived it have survivor's guilt. Some of us have PTSD.
In November of 1985 in San Francisco, gay activist Cleve Jones decided to create something that would reach out to the public about the crisis the gay community was going through. During a citywide march, Jones addressed the crowd, asking them if they knew anybody who was killed by AIDS. Almost everyone did. Jones instructed each of them to write the victim's name on a piece of paper and tape it to the wall of the city hall. They did, and Jones thought that it looked like a quilt. For months afterwards, he worked tirelessly with his friends to campaign this new idea, the Names Project AIDS Memorial Quilt. The idea was that mourning friends and or families of those who had died due to AIDS would create a panel the size of a casket for the deceased. The panel would bear their name and anything else that showed who they were. Designs, quotes, pictures, anything. These panels would be sewn together to create a quilt that would then be displayed. The first panel was made in the spring of 1987, in Jones's backyard, for his deceased partner Marvin Feldman. With help from friends and fellow activists, word spread of the AIDS quilt across San Francisco and then even further across the whole United States. October of that year, the quilt was displayed at the National Mall in Washington, D.C., where 500,000 people visited it. Jones had a few simple goals for the quilt.
The Names Project has three very simple goals. I wish they were simple. We're here to try and illustrate the enormity of the worldwide AIDS crisis by revealing the names and the faces and the lives that are behind the statistics. We're also trying to reach out to all the many different kinds of people whose lives have been invaded by this epidemic, to offer them a positive and creative means of expression, to help break through the silence and the misinformation that continues to surround the disease. And thirdly, we want to provide the whole world with a very clear, powerful symbol of how decent, ordinary men and women respond to a health crisis. And we hope that we can touch people's hearts and help them to understand that these are people very much like themselves. I think from the beginning, this has been a disease that we always thought of as something that happened to other people. And with the quilt, we're trying to show that even if there are other people, there are people who are like you, very much like you.
The AIDS quilt had a touching effect on people, whether it was from making a panel or from viewing it.
The benefits of creating it was that it was very therapeutic. It was a way of honoring those who had passed. For me personally, it was a way of memorializing my mother, who died very young. She was only 40 years old. And the things that were important to her, I could put on the AIDS quilt and kind of surmise who she was in a way that would be everlasting. Overall, for the nation, for the world, I think that the AIDS quilt is a very visual way of capturing the magnitude at which the world was being affected by the epidemic. And when you saw quilts for children and people who you might not have thought would be affected or infected with the illness, it made it a little bit more real.
Overall, the quilt was a huge success. Since 1987, over 14 million people have viewed the AIDS quilt. The awareness that the quilt raised for the AIDS epidemic was also able to spark change in the government. Then President Ronald Reagan mentioned AIDS for the first time that year, and federal spending on AIDS research went up sizably. In 1996, Bill Clinton became the first president to visit the AIDS quilt, showing America that the government was actively involved in the crisis, which was still raging on in the 90s. The magnitude of AIDS has generally diminished in 2019. Deaths from AIDS have gone down by 80% since the epidemic's peak, and in New York State, no babies have been born with HIV for 5 years. HIV and AIDS is still disproportionately affecting gay and bisexual men, but there are many new medicines to help combat the virus and let HIV-positive people live longer, healthier lives. As for the quilt, on November 20th of 2019, it was announced that the AIDS quilt will no longer be traveling, and will instead reside in San Francisco as a memorial display. This culmination of events proves that the AIDS quilt has fulfilled its duty of raising awareness, and has helped to break down the barriers that once shielded society from the reality of the AIDS war.